Hi, everyone. My name is Shelby Astle. I'm a doctoral candidate at Kansas State University, and I'm excited to share our findings about the quality of parent-child sexual communication and psychological sexual well-being. Parent-child sexual communication just means caregivers talking to children about sexual topics and is abbreviated in this presentation as PCSC. Social cognitive theory helps us understand that individuals develop knowledge, understandings of social rules, and socially constructed meanings by observing others. And for children, parents model the meaning of sexuality for children in both verbal and nonverbal ways, which then contributes to children's sexual well-being. However, a lot of times when we think about sexual well-being, the focus is on STI and pregnancy prevention, which is great and an important topic, but doesn't encompass the entire picture of what sexual well-being is. As the World Health Organization defines, sexual health is a state of physical, emotional, mental, and social well-being in relation to sexuality. It is not merely the absence of disease, dysfunction, or infirmity. So we need to be looking at sexual well-being in a more holistic way that includes psychological sexual well-being, such as self-efficacy, self-esteem, and lack of guilt or anxiety, to name a few examples. However, only a small number of studies have examined the relationship between parent-child sexual communication and psychological sexual well-being. So we wanted to find out if the quality of PCSC about different topics, sensitive value and risk topics, are associated with components of psychological sexual well-being, including sexual self-concept and sexual subjectivity. So we asked 278 undergraduate students to complete an online survey. We asked that our sample ended up being primarily female, heterosexual, and white. And we asked them questions about the quality of their parent-child sexual communication throughout their life about 20 different sexual topics. So we asked, thinking about the sexual communication you have had with your parents up until this point in your life, please circle the number that best describes how good or bad the communication about each subject was. We also asked questions about sexual self-concept, sexual subjectivity, and demographic factors, which I'll get into more on the next slide. This is the path analysis that we ran, and I'll walk through these variables. So when we asked about quality of PCSC about different topics, we ran an EFA and found that there were three main categories of topics. Sensitive topics included things like masturbation, oral sex, and pleasure. Value topics included things like abstinence, resisting sexual pressure, and monogamy. And risk topics included things like STDs, condoms, and unplanned pregnancy. We also controlled for gender, sexual orientation, if participants had experienced sexual debut, and if they had experienced sexual violence. For our outcome variables, these were components of psychological sexual well-being as measured by sexual self-concept and sexual subjectivity. And I'll give you an example item for each of these so you can get a better idea of what they're measuring. For sexual subjectivity, self-efficacy, if I were to have sex with someone, I'd show my partner what I want. Body esteem, I'm confident that a romantic partner would find me sexually attractive. Entitlement to self-pleasure, it's okay for me to meet my own needs through self-masturbation. Entitlement to partner pleasure, I would expect a sexual partner to be responsive to my sexual needs and feelings. Sexual self-concept, self-efficacy, I have the ability to take care of any sexual needs and desires I may have. And sexual assertiveness, I do not hesitate for what I want in a sexual relationship. And sexual self-esteem, I am proud of the way I deal with and handle my own sexual desires and needs. When we ran this path analysis, we found that we had good model fit, and we found that quality of PCSC about sensitive topics was associated with increased sexual subjectivity, self-efficacy, and body esteem, and sexual self-concept, self-efficacy, sexual assertiveness, and sexual self-esteem. Quality of PCSC about value topics was associated with decreased scores of sexual subjectivity, self-efficacy, entitlement to sexual pleasure, and increased scores on entitlement to partner pleasure, as well as decreased scores on sexual self-concept, self-efficacy. Quality of PCSC about risk topics was not significantly associated with any of our outcome variables. So let's talk through some of these findings. The fact that quality of PCSC about sensitive topics was associated with increased scores on 5 out of the 7 of our outcome variables may be explained by the fact that these conversations model sex positivity. In these conversations, parents are discussing various bodily functions, sexual activities, pleasure, and sexual orientation, and that may have served to normalize sex bodies and attraction, which then increased the children or our participants' feelings of psychological well-being. The fact that quality of PCSC about value topics was associated with decreased sexual subjectivity, self-efficacy, entitlement to self-pleasure, and our other measure of self-efficacy, and that it was associated with increased entitlement to partner pleasure, maybe because conversations on these topics, we know from previous research that these conversations often prioritize sex in relationships over solitary sexual experiences, which may explain why we saw increased entitlement to partner pleasure, because these participants may be conceptualizing, sexual pleasure happening within relationships and with a partner. And these conversations often focus more on avoiding or restricting sexual activity rather than advocating for personal sexual desires, things like saying yes. And on top of that, these conversations often promote heteronormativity and traditional gender roles, which may explain why we saw decreased scores in self-efficacy and entitlement to self-pleasure, since our sample was very heavily female, and getting messages about traditional gender roles like sexual gatekeeping may contribute to these decreased feelings of self-efficacy. And last, quality of PCSC about risk topics was not significantly associated with outcomes, which may be explained by the fact that risk topics just aren't doing it for psychological sexual well-being. We know talking about risk topics can contribute to a decrease in sexual risk behaviors, but potentially these findings are suggesting that if we want to improve psychological sexual well-being, focusing on other topics, specifically helping parents have high quality conversations with kids about sensitive topics, would be more important than talking about risk topics like STDs and pregnancy avoidance. We need to acknowledge that there are limitations of this study. Our sample was very homogeneous of mainly cisgender white heterosexual women in the Midwest. We need future research to find out if these associations hold out for different groups, and it would also be really helpful to use longitudinal methods to see if things that parents are talking with children about in childhood and adolescence have a more causal effect on what's going on for them in young adulthood, particularly their psychological sexual well-being, and research that measures what parents are actually saying about these topics rather than just what topics are they talking about. So with these limitations in mind, let's look at some takeaways. These findings suggest that the way college students remember how their parents talk to them about sex growing up is associated with their psychological sexual well-being. So parent educators can help parents develop skills to have quality discussions on more difficult topics throughout childhood, adolescence, and even emerging adulthood to help increase psychological sexual well-being. And parent educators should help parents and guide them on how to cover value and risk topics in more sex positive and holistic ways without using shaming and scare tactics that prevent children from wanting to have these conversations, and that can help children get a more sex positive modeling so that they can have increased and better psychological sexual well-being. Thank you.